Enhanced medication therapy management really targets people that are at high risk for adverse drug events. And who could that be? It's mostly elderly people. The government has a study out from the Center for Disease Control that shows that 50% of the elderly are taking 5 or more medications a day, and they have about a 50% chance of an adverse drug event once a year. When you get up to 10 medications a day, it's about an 82% chance of an adverse drug event once a year. So that's the people that we target, the folks that are taking multiple meds that are at high risk for an adverse drug event. They benefit the most. Yeah, part of the reason that we can do this now is because of the advancement of technology. The speed of which in half a second we can take 10 or 15 drugs and instantaneously give the user information. We can work in the cloud, so it can be used internationally, which it is. So the technology is really what has supported this. Plus, because of the technology, we were able to go back to the basics of science that we learned in pharmacy school, but we're not able to apply at the bench, because it was just too complicated and too difficult. But now with the technology, we can do instantaneous things we couldn't do even 5 years ago. One of the best practices is we've taken all this information that I explained, the multi-components of the simultaneous drug interaction system, and boiled it into a risk score from 0 to 50, 50 being terrible and 0 being wonderful. And so we can see right away a person's risk score. And we say, just like you know what your FICO credit score is for risk, credit risk, well, maybe in a few years we'll know what our medication risk score is for our mother's medications. So it's a score that's can carried and compared from one person to another. And also the good news is it's a score that can be lowered. So there's things you can do to change the regimen or change the time of day when they take the medicine. So if this one gets into those parking spaces first, we'll take this one first and we'll take this one at supper, for example, when it's clear, instead of taking them all at once. So the risk score has been very helpful in comparison and also in encouraging people that if we make some changes in the regimen, then you're going to have less risk for an adverse drug event.